Hi there. I'm Diana-Liz, and I'm a Daniel Amen brain health coach. And I'm with my dear friend, Pam Miles, who is also an Amen brain health coach. And we're inviting you to join our Klatch for brain health. So, Pam, what would you like to talk about today?
Well, Diana, I really wanted to talk about physical activity. Some folks call it exercise, others fitness. It's kind of a big umbrella, but basically it's movement. It's just getting up and getting your body moving, and it's so important. I realized that uh, after the COVID hit, everything kind of turned upside down for me. I had a really good exercise program. I was doing some high intensity interval training and some strengthening, as well as doing a lot of walking. And when the gyms kind of closed, it did a number on me. And so I could tell a difference in my overall health. I know that I've shared that we could definitely tell a difference.
Yeah,
And
I also experienced what they're calling COVID fatigue, and was actually tested for COVID, and had blood work done. And yeah, it had an effect. It had an effect on my glucose, and it had an effect on my cholesterol. And my fibromyalgia returned, and so did my psoriasis that I had beat 2 years prior. So it's not only important for physical health, but also mental health.
absolutely.
We have to keep moving. Yeah.
Mhm. And that is true, And the thing of it is you and I both had a pretty good regimen that we had going on. But I do want to mention that for those that really don't have anything particular that they've done, or maybe they haven't participated in any kind of physical activity, you don't want to start anything without your physician. I highly recommend going and talking to them and getting their input and making sure that you know what's going on and you're in tune with your body and you're in communication, with your healthcare provider. Because if you have too low of blood sugar, it's just as significantly, it will affect you just as much as too high. If it's below 100, then you really need to have 15 to 30 grams of carbs before you begin exercise, and then retest again right after that. If you're between 100 to 250, I mean, they pretty much say you're good to go.
Yeah.
But if you get above 250, then there's another, caution.
Hmm.
You really should be testing your urine to see if you're in ketosis.
Yeah.
And that is something that you also need to, like I said, be in tune with and be with your, healthcare provider on that. Um, but like I said, I believe everybody does need to have some kind of a really good program of some sort. It doesn't have to be going to the gym. I mean, I happen to enjoy that. I like it because it is a good social outlet. And that's good for us because we're able to connect with people. We build community. It's great for relationships, and that's really good for stress.
Yeah.
Um, it is for me. Now there are some folks that prefer to have things. They're more in tune with themselves, and that makes them more their comfort zone,
Mhm.
and that's fine. You really just need to find something you enjoy doing.
Yeah.
I've al- I've told my patients before, as a physical therapist, they just automatically assume that I'm going to tell them they're going to have to do this fancy exercise program. And I'm like, well, no, not, if you don't enjoy that, I'm not going to recommend that you do it because the thing is you won't do it.
You won't do it.
Yeah,
Yeah.
you might do with me, but you're not going to be compliant after your discharge. You're going to
Yeah.
go home and be like, well, I didn't like that. So, I mean, you need to look at fun activities. And you and I've talked about play.
Yeah.
How important it is. We as adults, we just tend to get stuck in a rut and oftentimes forget that play is so very important, to overall health of our brain and our bodies.
Yes.
And, I had mentioned before we were talking, and I said, my husband and I, we get out and play. We're like big kids. We have all kind of, tetherball and badminton, volleyball, horseshoes, cornhole. I mean, we live in the country, so we enjoy being outside, getting fresh air, vitamin D, just having fun.
Yeah.
And it's amazing, when you do something that you enjoy doing, how you feel.
Yeah. I think so too. People, there are formulas out there. You know, I know one is that you should do an interval to hit your peak level. And you figure that out by taking 220 and subtracting your age. And that may or may not be for you. If you haven't exercised and or done any kind of physical exertion, you can't start by reaching that level of,
Right.
you have to work your way up, and you really should have a doctor's clearance before you start to try and reach for any upper limits.
Absolutely.
Yeah.
Yeah.
And sometimes coaches, um, trainers in gyms are well meaning, but they may encourage you to move beyond your limits. And so if you exercise and you come home and the next day you're worthless, or maybe 2 days, then you have overdone it. It needs to invigorate you, and you need to feel good. And the next day you need to feel good again, not feel good one day and miserable for two.
Well, it's important rest. People don't understand that, but that is just as important as the activity itself,
Yeah.
is the rest. And you're right. Most people, myself included, I have to admit it, but we oftentimes don't know our limits. It's often the times you figure it out is when you have overdone it.
Yeah.
That's when well,
I think
I
I
could
did too much.
yeah, that was too much. I mean, I'm getting up, I'm hurting, I've overdone it. And so that's a pretty common thing.
Yeah.
But that's really important, is to try to find your limit,
Zone.
and
Yeah.
just stay right below it,
Yeah.
exactly. But yeah, that's in a nutshell, it really is important
Yeah.
to.
Well, I hope that our comments have been helpful to you, and that we've encouraged you and inspired you to get up and get moving, to find something fun that you enjoy and to do it so that you can be healthier and happier. That's our wish for you. So thank you for joining us. I hope you will follow us and join us the next time we Klatch on brain health. Bye for now.